Hi, I'm Dr. Behnaz, a certified pelvic floor specialist. Have you ever felt like you suddenly had to pee and just couldn't make it in time? Or maybe you go just in case before every errand? Or plan your outings around bathroom locations? If so, you may be dealing with urge incontinence, a very common, very treatable condition. Today, I'll walk you through what urge incontinence is, why your bladder might be overreacting, and how we retrain it through a step-by-step physical therapy. Let's start by understanding what's actually going on. What is urge incontinence? Urge incontinence is when you feel a strong sudden need to pee and can't hold it. It's often called overactive bladder and might be accompanied by leaking before you reach the bathroom, going 10 to 12 times per day or more, waking up multiple times at night to pee. Unlike stress incontinence, which happens with pressure like coughing or jumping, urge is about bladder signals misfiring. Okay, let's see what causes the urge incontinence. Your bladder is a muscle and it feels gradually when it's time to go. Your brain and bladder communicate. So the bladder sends a signal up, your brain's response, your pelvic floor relaxes, and the bladder contracts. In urge incontinence, this system becomes hypersensitive. The bladder muscle contracts too early or too strongly. Common triggers and causes of urine urge include frequent just-in-case bathroom visits, caffeine, acidic or spicy foods, carbonation, scar tissue or nerve disruption from past surgeries, hormonal changes like menopause, a tight or overactive pelvic floor that doesn't relax properly. Even a stress incontinence can lead to urge if the brain starts to anticipate accidents and sends early warning signals. Okay, let's see how we assess the patients with urine urge incontinence. We do bladder diary, how often you go, how much you drink. We do also pelvic floor evaluation, checking if your muscles are tight, coordinated, or overactive. We do functional testing. Are you holding your breath, clenching or pushing down during movement? We also look at habits. Are you running to the bathroom with the first urge? Are you avoiding fluid? Are you drinking too much caffeine? Let's see how our therapy plan is for you. We don't just strengthen muscles, we retrain the nervous system and calm bladder overactivity. So we retrain your bladder. This is about teaching your bladder to wait when you feel a sudden urge. We ask you to stop, don't rush to the bathroom, stand or sit still, contract the pelvic floor 3 to 5 times, spread out and raise your toes. Take slow, relaxed breaths. Distract your brain. Count backward. Sing or breathe deeply. And then walk calmly to the bathroom after the urge fades. This helps reprogram your bladder and brain instead of reacting instantly. You start to take control. So, we ask you to change your fluid habits. We see if you are taking bladder irritants like caffeine, soda, tea, alcohol, and acidic foods. Check out your fluid intake volume. Too little can irritate the bladder, too much can overwhelm it. You should know that just in case peeing, this trains your bladder to empty too early and too often. We gradually increase voiding intervals, aiming for every 2.5 hours to 4 hours. Most people think that pelvic floor therapy is just about squeezing. But with urine urge incontinence, we often need to release and relax. We work on diaphragmatic breathing, pelvic floor down training, pelvic floor relaxing, releasing. We also release your abdominal tension, stress reduction techniques if anxiety is a trigger. This is especially important if urgency started after trauma, childbirth, or surgery. Once you've learned to calm that strong urge to pee, we move on to training your pelvic floor for real-life situations. We practice holding the muscles for up to 10 seconds to build stamina. during quick squeezes for sudden moments when you need control, and matching your muscle work with your breathing and movements. Our focus isn't just on making the muscles stronger, it's about helping them react at the right time and making you more aware of how your body works. So let me bring you a real life case. A 45-year-old teacher came to me leaking on her way to home from work, sometimes even in the driveway. She went to the bathroom hourly, drank only a little water, and avoided all fluids before leaving school. Her pelvic floor was tight and tense, her bladder overreactive, and her brain had learned to panic every time she saw her front door. We work on urge suppression strategies, relaxation techniques, gradual bladder retraining, gentle pelvic floor release exercises, and slowly increasing her water intake. Within 6 weeks, she was going every 3 hours, drinking more, and had 0 accidents. And key takeaways for you. Urge incontinence is about miscommunication, not just weak muscles. The goal is to calm the bladder and retrain its timing. Treatment includes breath, behavior, relaxation, and strategic strengthening. With the right steps, you can take back control. Our next video is about mixed incontinence, when both strength and urge symptoms occur together. I teach you how we decide what to treat first and how we build a plan that addresses both. Until then, remember, you are capable of healing and you're not alone. I'm Dr. Behnaz, a certified pelvic floor specialist. Stay informed with our evidence-based pelvic health guidance. Subscribe to the channel, like this video, and activate the notification bell to receive updates on future educational content.